Hello, I'm Dr. Pizzadili, and welcome to my series on happy outcomes for cancer patients. Number 1, this is about bile duct carcinoma. These case reports are from the book One Man Alone, an investigation of nutrition, cancer, and Dr. William Donald Kelly, written by Dr. Nicholas J. Gonzalez. It was completed in 1987. Published in 2010 by New Spring Press, and this research was supervised and the cases verified by Dr. Robert A. Good, MD, PhD, who at the time was director of Memorial Sloan Kettering Cancer Center, one of the oldest and largest cancer research and treatment centers in the world. Patient number 1 was a male who died at age 59, and he had survived nearly 6 years on Dr. Kelly's program after his diagnosis of bile duct carcinoma. Now that's important because very few patients live for 5 years with that diagnosis, and experts estimate the average survival is less than 1 year. It began in September 1976 when the patient had intermittent abdominal pain. His medical doctors diagnosed ulcers and gave him antacids. In October of '76, he suffered severe nausea and vomiting, and over the next 6 weeks he lost 28 pounds. In November of '76, he was jaundiced, and so he was admitted into DeKalb General Hospital in Georgia. In the hospital, lab studies showed elevated liver markers and possible obstruction of his bile duct. In December '76, he was discharged and sent home and told to continue with his antacids. But at home, he continued to deteriorate. So he was readmitted to DeKalb Hospital, and exploratory surgery found a large inoperable tumor in his bile duct system. And this is a quote, "Carcinoma of the right hepatic bile duct with extension into the left and common hepatic ducts with total obstruction." Very serious diagnosis. At the time, his surgeon believed the disease was terminal and chose not to even risk a biopsy. So patient number 1 had brief radiation therapy to his right upper abdomen that was aimed at relieving the ductal obstruction. He was released and he continued to worsen after going home. In desperation, he decided to investigate unorthodox cancer therapies. In March of '77, patient number 1 learned of Dr. Kelly and began his program of nutrition, detoxification, and pancreatic enzymes. Now, days after meeting Dr. Kelly, he got an infection of his bile duct system and re-entered DeKalb Hospital. He began bleeding profusely along his gastrointestinal tract as a complication of that liver failure. His doctors opted to not even treat his bleeding as he seemed so close to death. However, patient number 1 rallied and he went home to resume Dr. Kelly's program. He improved somewhat over the next 3 months. But in August '77, he developed ascites, that's a swelling in the abdomen. He was readmitted into DeKalb. Hospitalized for a while, he improved enough to go home and resume the nutrition program. His discharge diagnosis, terminal carcinoma of the bile duct with ascites. In November of '77, the ascites worsened, and he had a Levine shunt installed to drain the excess fluid. So over the next 5 years, patient number 1 enjoyed a reasonably good quality of life. Patient number 1 faithfully continued Dr. Kelly's program of nutrition, detoxification, and pancreatic enzymes, except when hospitalized. He had frequent hospitalizations for bleeding and problems related to liver failure. Problem is, the liver failure was worsened by the earlier radiation treatment. In May of 1982, 6 years after diagnosis, the patient lapsed into a hepatic coma and died. Now understand, few patients survive this diagnosis even 1 year. Quote, diagnosis of bile duct cancer, like that of hepatocellular and gallbladder carcinoma, is poor. And in one study of 63 patients, only 4 survived more than 4 years. The median survival for surgically unresectable bile duct cancer is 5 months. So patient number 1's unusual 6-year longevity can only be attributed to Dr. Kelly's program. According to Dr. Kelly, the patient would have done better had he A, avoided radiation to the liver, and B, been allowed to continue his nutrition and detoxification program while he was hospitalized. The only conventional cancer treatment that patient number 1 received was the radiation, which damaged his liver and contributed to the severe chronic liver failure that ultimately killed him. Following Dr. Kelly's program of nutrition, detoxification, and pancreatic enzymes allowed patient number 1 to survive 6 years that he otherwise would not have had. And imagine what that was worth to him, to his family, the people who loved him and depended on him. Here we see how under conventional cancer treatment, the patient faced pain, misery, and certain death. Then they chose a non-toxic alternative and got a much different outcome. Their health was restored, and they lived and enjoyed life far beyond all predictions. We must remember, the cancer industry is focused on shrinking tumors and not on restoring health. We know that conventional cancer treatment is risky. Chemotherapy and radiation themselves cause cancer. Surgery and biopsy spread cancer by releasing circulating tumor cells. So instead of all that, we work together with you to restore health so that your body rids itself of cancer. Now it's time to think about the people who love you, the people who depend on you, the people who want you around, and how important you are, and ask yourself, are you doing everything possible to recover your health? To optimize health and defeat cancer, we must establish 6 fundamentals. Number 1, we need an optimal body pH. That's the acid-alkaline balance. Your body pH must be in the right zone in order for digestion, immune system, and all other biochemistry to work properly. We must balance hormones. We're in an epidemic of hormone-related cancers. Breast cancer, uterine cancer, ovarian cancer, prostate cancer, testicular cancer. Well, Dr. Kelly wrote that he felt that it was excess estrogen that triggers all cancers. We must detoxify the body, mind, and emotions. We're in daily exposure to thousands of toxic chemicals that were not around 100 years ago. And most of us carry toxic thought and emotional patterns that block healing. Detoxifying all 3 is critically important for every cancer patient. We must eliminate infections. Now, cancer often shows up when the body is exhausted from fighting chronic infection and inflammation. For example, the leading cause of liver cancer is chronic hepatitis C. Now, you may have chronic and untreated infections that you don't even know about. We must rejuvenate depleted organs, glands, and systems. The biggest single risk factor for cancer is aging. And folks, that means everybody that's 40 and up. Over time, our body is depleted of essential nutrients and enzymes so that normal systems break down and chronic disease and cancer take hold. Then we must use the best proven cancer-fighting natural methods. There are natural methods that are proven to turn off and kill cancer cells. And we work together and determine which ones work best for you. Unfortunately, chemotherapy and radiation make all those important health factors worse. Not good. So we come back to this. I'm not going to be your MD or your oncologist. Those treatment decisions about chemo, radiation, surgery, those are between you and the prescribing doctor. But I will work together with you to restore health so that your body heals itself. These patients in my Happy Outcome series, they had the courage to take their fate into their own hands. They did so in spite of opposition from MDs and in some cases opposition from their families. And they enjoyed recovery and health completely outside anything seen in conventional cancer care. Ask yourself again, are you doing everything possible to recover your health? Then call my office, 907-272-6299, and make an appointment. I look forward to seeing you, and I look forward to changing your life for the better. Thank you. I'm Dr. Pizzadili.